Welcome back at 7:14. This month is Colorectal Cancer Awareness Month. Doctors say colorectal cancer is hitting patients younger and younger, and the CDC reports colon cancer is the second leading cause of death in the United States for men and women. With us this morning is Dr. Staudinger, a gastroenterologist with Touro Health, who has details on some of the new guidelines for screening for colorectal cancers and details on the risk. Good morning. Thank you so much for being with us.
Hi. Thank you so much for having me.
So I mentioned colon cancer, but is that the only cancer that falls under the category of colorectal cancer?
So colorectal cancer is a cancer involving the lining of the large intestines, the colon, or the rectum. It's thought that it grows from small growths in the lining of the intestines, which we call polyps. Over time, those polyps can grow and turn into something more dangerous, cancer.
And I know we just were talking about the screening guidelines have changed a little bit, but before we get there, I know some cancers that you may have a sign or symptom that something might not be quite right that pushes you to go to the doctor and start those conversations and screenings. That's not always the case with colorectal cancers, is that right?
That's exactly right. So colon cancer is often asymptomatic. There are no symptoms in the beginning. Now, as it becomes more advanced, you can develop symptoms. Certain things you want to look out for definitely are bleeding, blood in the stool, changes in your bowel habits, weight loss that you can't explain, or really any other symptoms that you're kind of unsure about and that have popped up.
And up until recently, the screening guidelines were 50 years old and up, but the number has come down to 45 now, is that right?
That's right. Within the last couple of years, they changed the guidelines and recommend actually that average risk individuals start getting their colonoscopies or their screening test at age 45. And that's because we're finding an incidence of colon cancer at a younger age. Now, patients who have a family history of colon cancer or high-risk polyps should talk to their doctors because they may need to get their colonoscopies at an earlier age.
And you mentioned colonoscopies, you mentioned other screenings. So what are there are really just two options to screen for this type of cancer?
These are the two most popular options, I would say, right now. A screening colonoscopy is a test where your gastroenterologist takes a camera that's at the end of a long flexible tube and looks on the inside of your colon for these small growths, colon polyps or colon cancer. At that time, they're able to remove polyps if they see them and take biopsies of any abnormalities that they see. A colon stool test or a test that checks for blood in the stool or DNA markers of colon cancer. This test is great and patients love it because they're able to do it from the comfort of their own home. If it comes back positive though, then you do need to have a colonoscopy.
But the key is getting back to doing these screenings, especially if you're in that age group 45 and up, or if you have a family history, and having those conversations with your doctor to move forward with treatment if necessary.
Exactly. The best test is the one that gets done.
I love that. And that goes for all screenings, but
yeah,
specifically this morning talking about colorectal cancer.
Right.
Well, Dr. Staudinger, we appreciate your time this morning. Thank you so much.
Thank you for having me.